Assalamu alaikum wa rahmatullah. I'm Khaled from year 2, and today, inshallah, we're going to be discussing the arteries that supply the gastrointestinal system. Bismillah. Now, before discussing the gastrointestinal system or the arterial supply of it, I wanted to first of all divide the GIT tract into three important main parts, which is the foregut, midgut, and hindgut. And طبعا whether the organ lies in the foregut, its arterial supply is going to be from the celiac trunk, and if it lies in the midgut, its arterial supply will be the superior mesenteric artery, and it lies in the hindgut, its arterial supply will be the inferior mesenteric artery. And طبعا all the celiac trunk, superior mesenteric artery, and the inferior mesenteric artery, they're all branches from the abdominal aorta. But let's now discuss what are the organs that make up the foregut, midgut, and hindgut. طبعا for the foregut, it always starts from the abdominal esophagus and moves all the way to the proximal part of the second part of the duodenum. And then for the midgut, it's a continuation from for the second part of the duodenum till the 2/3 of the transverse colon, and then proximal 2/3 of the transverse colon, and then the distal 1/3 of the transverse colon till the anal canal. We call it the hindgut. So, as I said, depending if the organ lies in the foregut, midgut, or the hindgut, its arterial supply will be the same. For the foregut, it's a celiac trunk. For the midgut, it's a superior mesenteric artery. And for the hindgut, it will be the inferior mesenteric artery. And I'm going to be discussing each and every trunk and what are the branches that come out from each of them. We just had a very brief idea about each trunk and how will the GIT tract be divided. Now let's start to talk about every and each branch in detail. First of all, I'm going to start with the celiac trunk. And I just said that the celiac trunk is the main supply for the foregut. And I also said that the foregut is basically from the abdominal esophagus until to the proximal part of the second part of the duodenum. Now, it's very important when we talk about the celiac trunk or any branch of the abdominal esophagus to talk about the vertebral river will this trunk will come out of. In our case, the celiac trunk comes out near the L1 vertebra, and it's a very common exam question that the doctors like to ask is the vertebral level that this branch comes out from. And as we remember, it is below the aortic hiatus. Now, let's talk about the branches that come out of the celiac trunk. There is three important branches that we need to consider when talking about the celiac trunk. First of all, we have the left gastric, and then we have the common hepatic, and then we have the splenic. Now, let's talk about each and every branch. Let's start first of all with the left gastric. As you can see here, this is the celiac trunk, and it's giving out three branches. First branch is the left gastric. As you can see here, the left gastric is ascending upwards, and then it's giving off some branches. And these branches, we're going to call them the esophageal branches. And these esophageal branches give arterial supply to the abdominal esophagus. And then it's going to descend downwards on the stomach. And to be exact, it's on the lesser curvature of the stomach. And it's going to do anastomosis with the right gastric artery that comes out from the common hepatic. Now, moving on to the splenic artery. Now, the splenic artery is basically the second branch of the celiac trunk. And as you can see here, it's going posterior to the stomach. And then also you can see that the splenic artery is having a tortoise-like direction. Why is that? Because as we know, the stomach is very distendable. And it's the most distendable part of the GIT. But if you have a straight artery, what's going to happen whenever the stomach tries to expand, this artery might rupture. So, this artery was made that way so it can keep up with the distendability of the stomach. And then once it reaches to the end of the stomach, you can see that it's giving off two important branches, which is the short gastric branch, and it's giving supply to the fundus of the stomach, And then we can see it's giving off the left gastroepiloric artery. The left gastroepiloric artery, as you can see here, it's descending downwards on the greater curvature of the stomach, and it's anastomosing with the right gastric artery. And they will be the main supply for the body and the pyloric part of the stomach. And as you can see also, the splenic artery is giving off some perikinetic branches, and of course it's going to give supply to the spleen, since it's called the splenic artery. Now moving on to the last branch of the celiac trunk, which is the common hepatic artery. As you can see here, the common hepatic artery has three important branches that we need to consider. The first one is the right gastric, which I already mentioned before, and it is anastomosing with the left gastric that came out of the celiac trunk directly, and they will both anastomose on the right gastric. The second branch that we need to consider is the gastroduodenal artery. And as you can see here, the gastroduodenal artery, as it descends downwards, it's giving off two important branches, one of which is the right gastric epiloic artery, which I just mentioned. It will also anastomose with the left gastroepiloic that came out of the splenic artery, anastomosing on the right greater curvature of the stomach. And then the second branch the gastroduodenal artery is giving is the superior pancreaticoduodenal artery, and from the name you can guess that it gives supply to the pancreas and the duodenum. And the third and the most important branch of the common hepatic is the proper hepatic. And from the name you can guess proper hepatic means it's solely to the liver. However, I've seen some resources that say that the gastroduodenal come out from the proper hepatic. However, that's not a very significant information, but we need to consider that we have three branches and one of them is the proper hepatic. Once it enters the liver, the proper hepatic divides into two, the right and the left hepatic arteries. And the right hepatic artery is going to give a very important branch that supplies the gallbladder, which is the cystic artery. This is basically the supply for the celiac trunk. Now moving on to the second branch that supply the GIT, which is the superior mesenteric artery. The superior mesenteric artery, as I just mentioned, it is the main supply for the midgut. And as I also mentioned, the midgut consists of the distal part of the second part of the duodenum until to the proximal 2/3 of the transverse colon. Now, as we always mention, for every branch we have to know where does it start, or the vertebral river that this artery branch comes out from the abdominal aorta. For this artery, the superior mesenteric artery, it comes out from the lower border of L1. And we need to remember some important relations that are for the superior mesenteric artery. We need to remember some anterior relation and some posterior relations to this artery. Now, for the anterior relations, as you can see here from this picture, it shows the relationship to this artery in a very clear way. As you can see here, I've removed the neck of the pancreas. So it means that behind the neck of the pancreas, the artery was visible. So anterior relation is the neck of the pancreas. And as you can see here, this is the splenic vein making up the portal vein, with the superior mesenteric vein and the splenic vein, when they join together, they make up the portal vein. So behind the splenic vein, we could see the superior mesenteric artery. Now, for the posterior relationship of the superior mesenteric artery, we can see here the left renal vein. And as you can see here, it's very visible that it's behind, or it's a posterior relation to the superior mesenteric artery. And as you can see here also, the ulnate process of the pancreas is behind the superior mesenteric artery. And then this is the third part of the duodenum, and it's very clear that it is a posterior relation to the superior mesenteric artery. Now, for the sake of easiness, you can remember that the superior mesenteric artery is like sandwiched between two veins. Our first vein is the splenic vein, and then the left renal vein, and between them is the superior mesenteric artery. Now, moving on to the branches that the superior mesenteric artery gives. It gives the inferior pancreatic duodenal branch, what I mentioned earlier, and it will anastomose with the superior pancreaticoduodenal, and then it will give some right side branches, which I like to combine them to say right, because they're basically composed of the middle colic, right colic, and the ileocolic. And then it gives off some left side branches, which is the jejunal and the ileal branches. Now I'm going to discuss each of them to better understand these branches. And as you can see here, the inferior pancreaticoduodenal, it's ascending upwards to anastomose with the superior pancreaticoduodenal artery. And the superior pancreaticoduodenal artery, we mentioned earlier that it's a branch of the gastroduodenal, and the gastroduodenal is a branch from the common hepatic, and the common hepatic comes off from the celiac trunk. So, to be detailed, the main things that the pancreaticoduodenal artery supplies is the head, the ulnate process of the pancreas, and the duodenum, as we mentioned. Now, moving on to the right side branches of the superior mesenteric artery. Actually, the right actually the superior mesenteric artery gives off some left branches on the left and branches on the right. Now, for the branches that are on the right, first of all, we need to discuss the middle colic. As you can see here, middle colic, because it will be between the right and the left colic arteries, and the left colic artery will discuss in the inferior mesenteric artery branches. But let's first talk more about the middle colic. The middle colic is basically going to give off some right and left branches, and the right colic is going to give ascending and descending branches. And as you can see here, the ascending branches of the right colic, they're anastomosing with the with the right branches of the middle colic. And the last branch that come off of the right side branches of the superior mesenteric artery is the ileocolic artery. And the ileocolic artery is also going to give us ascending branches and some descending branches. For the ascending branch, it's going to anastomose with the descending branch of the right colic. This is the right colic, and this is the ileocolic. For the descending branch, it's going to give off some cecal branches, which are going to supply cecum, anterior and posterior cecal artery, and it's going to give appendicular artery, which is going to supply the appendix. As you can see here, this is the appendix of the large intestine, and it's also going to give us some ileal arteries that supply the terminal ileum. As the name suggests, it's an ileocolic artery, so it means it gives some supply to the ileum, and it can give supply to the colon. Now, moving on to the left side branches, as you can see here, the left side branches, they are mainly supplying the small intestine, the jejunum and the ileum. And as you can see here, there is some straight arteries, and we call these straight arteries the vasa recta. And the curve-like arteries, we're gonna call them, they're called the arcades. So the vasa recta, they're like functional end arteries. So if there is any blockage in them, they can lead to infarction to the area that they supply in the small intestine. However, if there is a blockage in the arcades, it won't be much of a problem because they're not functional end arteries. However, the problem lies when there's a blockage in the vasa recta, because they are the functional end arterial supply for the small intestine. So if there is any blockage in them, they're going to affect the area that they're supplying of the small intestine. And that's all for the superior mesenteric artery. The last branch that we're going to be talking about is the inferior mesenteric artery. And as I mentioned, the inferior mesenteric artery is the main blood supply for the hindgut. And the hindgut is basically the distal 1/3 of the transverse colon till the anal canal, which is the end of the GIT tract. And to be exact, in the anal canal, it's above the pectinate line. As you know that the anal canal is divided into the above the pectinate line, this is the pectinate line, and then below the pectinate line, and it supplies to the above the pectinate line in the anal canal. Now, as we always do whenever we discuss any branch, we have to know the vertebral level that this branch comes out of. And for the inferior mesenteric artery, it comes out of the level of L3 vertebra, and it is the smallest of the three aortic branches we just mentioned. Now, moving on to the branches that this inferior mesenteric artery gives, we need to talk about the left colic artery, sigmoid branches, and the superior rectal artery. For the left colic branch, which I just mentioned, it is giving supply for the descending colon, and it gives supply to 1/3 to the distal 1/3 of the transverse colon, because it's considered part of the hindgut. And as you can see here, it's also giving off ascending and descending branches. And the ascending branches, they're going to anastomose with the left part of the middle colic arteries, and the descending, they're going to anastomose with the sigmoid arteries. Now, moving on to the sigmoid arteries, they run in the sigmoid mesocolon to supply the sigmoid colon and the lowest part of the descending colon. Now, as you can see here, this is the sigmoid arteries. They are supplying the sigmoid part of the colon, and they're going to give off some supply to the descending colon, and they're going to anastomose also with the left colic. Now, moving on to the last branch of the inferior mesenteric artery, which is the superior rectal artery. And as you can see here, it descends to the level of S3 vertebra. Now, something that we need to know about the superior rectal artery, that it is a terminal or a continuation to the inferior mesenteric artery. So, at the end of the inferior mesenteric artery, it ends as the superior rectal artery, and it gives off two terminal branches, and they give smaller branches down to the internal anal sphincter. And as you can see here, we can get to know more about the branches of the superior rectal artery. They basically anastomose with the branches from the middle rectal artery, and the middle rectal artery comes from the internal iliac artery. And then they also anastomose with the inferior rectal artery, which is a branch of the anterior pudendal artery. As you can see here, this is the superior rectal artery. It's supplying off the anal canal, and it also gives some supply to the sigmoid colon, which is very minimal. Finally, as all the colic arteries anastomose together, they make up like a loop around the large intestine. And this loop of anastomosis, we gonna call it the marginal artery. And the marginal artery is basically made up of anastomosis of the ileocolic artery, right colic artery, middle colic artery, left colic artery, and the sigmoid arteries. So they all anastomose together and make like a loop around the large intestine, and this loop we call it the marginal artery. And this makes up our GIT arteries. If you have any question, you can drop it down in the comment section, or you can just directly message me on WhatsApp. Thank you all for listening, and have a nice day.